Hey everybody, Claire Fitzgerald again, research fellow here at the Government Outcomes Lab. It is really nice to see everybody. Welcome to this week's session of ERGO, Emergency Responses and Government Outcomes Peer Learning Group. I want to thank each of you for spending some time with us today. We'll start with a bit of group business before we move into our very exciting panel discussion. So for the new folks we have joining us today, and there are quite a few of you, the goal of ERGO is really to provide a platform for those in government, in provider organizations, academia, and other sectors to share their experiences of emergency and response, emergency and disaster sort of recovery and response. And not just talking about COVID-19, but really reflecting on wider experiences and implications for outcomes-based approaches. So we've been meeting since early April, and many members have very graciously jumped into panels and provided feedback, all of which has really helped us to ensure that we're doing what we set out to do. So sincere thanks to those of you who have contributed. I'm very much looking forward to working with others in future sessions. So speaking of future sessions, we next meet on June 10 at 3:30 UK time, so that's next Wednesday. And we're going to use Zoom breakout rooms, y'all, so I hope you can join us and jump into what is sure to be a very interesting discussion. We are also still in the process of planning what our July ERGO meetings are likely to cover. So if you've got something you'd like to discuss, please drop us an email or complete the short online survey. You can find the details for both of those things at the bottom of your agenda for today. Dates for the July sessions are likely to be the 8th and the 15th, but we'll confirm those shortly. Likewise, for new folks and for those of you who have been joining us for a while now, if you want to see details on ERGO meetings that you've missed, you'll find notes for the first few, as well as videos from every session that are all uploaded to the GoLab website. Further meeting notes from our 22nd of April session, which was on transparency and accountability, and notes from the 6th of May session on COVID-19 in lower and middle income countries will be uploaded later this month. Likewise, I wanted to say, as I always do, that any policy briefs or memoranda which we sort of use ERGO conversations to inform, we will share with participants. We've got some things sort of floating around in draft, so hopefully that will be coming out soon on a number of different topics. But to enable these kinds of outputs, as well as to circulate notes, we will be recording today's session. Likewise, you might have noticed that today we do have a slightly different structure than we've had in prior weeks. So it's a bit more discussion and a bit less presentation. You're also going to hear less of my voice because my colleague Tanya Hamid will be chairing portions of today's conversation. So Tanya, do you want to hop on and just wave and say hello so folks can put a face to your name?
Sure. Hi everyone, this is Tanya. We're looking forward to the discussion today.
Thanks for that. So before we get into it, just a couple gentle housekeeping reminders. Please keep yourself muted unless you're speaking. And as time allows, we will invite you to comment and question the panel. And when this happens, if you want to speak, the best thing you can do is raise your hand using the raise hand feature in Zoom, and we'll invite you to speak up. And when you do, it'd be great if you could tell us who you are and sort of maybe what your point of view is and why the question that you're asking is something that's important to you. Likewise, if you prefer to type rather than to speak, you can use the chat function at any time during the session. And since it is a panel discussion, I would actually recommend using that chat function liberally. So if you've got a question that pops into your mind, go ahead and put it in there, and we'll use the questions that we gather in chat as the session progresses to sort of kick off the Q&A towards the end of the agenda. And we'll do our best to get to everybody, but we probably will miss folks, so I apologize for that. So with that, I'll just sort of frame up some of the conversation for today, and then I'll pass it over to Tanya. So I think a lot of people recognize the importance of learning from this pandemic in a way that is sort of, I suppose, inspired both to understand better the triumphs and shortcomings of immediate response efforts, but also a sort of growing sense that there's an opportunity to inform deeper questions about our social and economic systems that the crisis has really, I think, very starkly brought to the fore. And over the Ergo series of meetings, I think we've had a sort of thread of discussion, which has been around how COVID-19 can complicate, can erode, can affect ongoing efforts to measure the effectiveness or indeed like the impact of public services, be they delivered through an outcomes-based contract or not. And as I mentioned, I really do think a key reason why this topic or this thread keeps coming up is because people really want to or need to understand what works given the current context, and indeed envision using that kind of understanding to drive continual improvement to services, not only during response and recovery phases, but also into whatever new normal we're all facing. And as part of that learning process, I think research and evaluation really represents a critical learning opportunity for public policy and social services. But adapting our sort of existing measurement and research and evaluation plans to account for this massive shock is really a tall and very complicated order to fill. I think also the pandemic throws up a whole host of new research questions and opportunities, which in some cases have to be weighed against the sort of initial scope of inquiry and the relative benefits or merits of changing that midstream. And I think a lot of people are thinking about this, but there hasn't always necessarily been space to sort of begin to pull out that nuance in conversation. But that's what we're going to try to do today. So we've brought together researchers and evaluators from different sectors and in different roles who'll kind of be giving us a bit of a peek into their own brain and speak with us across sort of 4 different topic areas. You can find these at the top of your agenda, but just to summarize and highlight, we're looking at sort of the disruptions and challenges that our panelists are currently facing in their own work, maybe any special considerations that those who do research on outcome-based contracts and impact bonds feel are important to highlight about research tied to those models. We also are curious to hear how researchers and research funders can think through the relative benefits and costs of continuing with existing research plans or changing them perhaps midstream. And then also, we really want to understand what people think the new frontiers are. What are these new learning opportunities that COVID-19 is presenting to them in their own work? So in terms of who we've got joining us, we've got Bert Barnau, who's the Amsterdam Professor of Public Service and Economics at the George Washington University. We've got Celeste Brubaker, who's Vice President of Impact at Village Enterprise. Eleanor Carter, our own Research Director at the Government Outcomes Lab. Avnish Gungadurdoss, who is the co-founder and managing partner at Instiglio. James Ronicle, who's an Associate Director at Chorus UK. And Neil Stanworth, the Director at ATQ Consultants. I'll also flag that we may be joined later on by Richard Simmons, who's a senior lecturer in sociology, social policy, and criminology at the University of Stirling, but that's TBD, so we'll see if he's able to show up. So with all of that in mind, I will pass things over to you, Tanya.
Great, thank you so much, Claire. Hi everyone, thank you so much for joining us today. Really nice to see some very familiar faces and names. For those of you who don't know me, I'm a Research and Policy Associate here at the Government Outcomes Lab at the University of Oxford, and my current work is very much around evaluations and research on impact bonds in the UK. So today's session, the theme really resonates with some of our ongoing conversations within the team, particularly within our research team, because like everyone else, we've also faced disruption in our projects and our work and have been doing our best to adapt. So this is a really great space to be learning from each other. But also on a personal level, I've also been thinking a lot around how as researchers and evaluators, what is our contribution or our role during this pandemic, given that we are not really on the front line ourselves, but a lot of the partners that we work with are. So what to me is an important question as well is how do we capture the learning? How do we strike the balance between providing quick intelligence, but also retaining our credibility and also ultimately helping policymakers make really important decisions at this unprecedented time? So with all that in mind, it would be really nice to kick off with the very first part of this session, which is very much around understanding what people have been working on, so what people's current research and evaluation projects are, what are the sort of challenges and disruptions they've been facing, and then particular examples of how they are adapting their work. So if I could start with you, James, it would be really great to hear a bit more about the main research and evaluation projects that you're working on currently.
Thank you, Tanya, and good afternoon, everybody. I'm an associate director at Acoris. We're a research and evaluation organization. We have about 100 research and evaluation projects going on currently at the moment. I'm not involved in all of them. I'm probably involved in about 12 of them to some different degree. Some of them are based on outcomes-based contracting, some of them aren't. So the main ones that I'm currently involved in, one is looking at adoption reforms across the UK. One is looking at the role of social investment and how that impacts on the financial resilience of social enterprises. One is a large-scale SIB evaluation in the UK. One in Latin America, looking at SIBs in Latin America, and a DIBS evaluation in Africa and Asia.
Great, thank you so much. And if anyone else would also like to contribute, maybe Elle, Avnish, talk a little bit about the projects that you're working on currently.
Great, thanks. Yeah, at the Go Lab, we have quite a varied portfolio of research work. Probably our most hands-on primary research work at the moment is as part of the Life Chances Fund. So that's a series of social impact bonds that have been commissioned by local government. And as well as that, direct primary research, we're aiming to connect our empirical studies to wider academic concepts and debates, particularly where these provide helpful frameworks or tools for practitioners and government decision makers.
Great, thank you so much.
Yeah.
But also sorry.
I could go next if you want.
Please.
Hi everybody, my name is Avnish. I'm from Instiglio, as was introduced. Thanks again for hosting this great session to the Go Lab team. So just broadly speaking, I'm coming a little bit more from a practitioner's angle. We are involved in a number of transactions in the social impact bond space, but also in the broader pay for results spectrum. So we have two impact bonds that are currently in implementation, one in Colombia on workforce development, which, as you can imagine, has been heavily affected. The other one is with Village Enterprise, DFID, and USAID in Uganda and Kenya on poverty alleviation. So both of these projects, we're having to figure out how to adjust and adapt evaluation plans, but also look at opportunities of how these projects can contribute to the urgent needs for data and evidence at this point in time from our government counterparts. Also have some more recent, recently launched Pay for Success projects in Morocco and workforce development. And then have been in the process of launching two different outcomes funds, which have, as a result of the coronavirus situation, in both cases taken a rapid turn to provide to structure experiments that can generate new types of learning. So it'd be good to share a little bit more on that and adapt a little bit to the context, especially responding to demand from our government counterparts to provide insights on how intervention models need to adapt and how operationally speaking we can learn what works and what doesn't.
Thank you so much, Avnish. Speaking of challenges and disruption, I was wondering if I could turn to you, Celeste, and learn a bit more about the challenges of tracking and measuring outputs, particularly within the Village Enterprise Development Impact Bond.
Sure, thanks so much. So for the development, for our development impact bond, we are approximately 2/3 of our outcomes funding that's available under that project is awarded for impact that is verified through a randomized control trial at conclusion of the program. And so it's a 7-cohort development impact bond, and the first 4 cohorts were scheduled to be evaluated in April 2020, and then the last 3 cohorts in April 2021. And so the biggest hurdle that we're facing right now is that April 2020 is when COVID-related restrictions were in full effect. So that first round of evaluation had to be what we are hoping is just postponed. Our current sort of priority or line of thought for the evaluation is that we do want to move ahead with this midline evaluation if possible, but that ultimately if we can't conduct the evaluation where if we're not able to start data collection by the beginning of October, that likely we will be looking at a situation where we would need to cancel the midline data collection and start looking towards other solutions, potentially combining the midline and endline into one larger endline in 2021. So that's one big logistical challenge. And then the other challenge that we're trying to reconcile when it comes to the evaluation is, in particular, the approach that we're using to calculate the lifetime impact for beneficiaries, and if initial assumptions that we put into our framework are still relevant given the effects of the pandemic, or if we need to update any of our assumptions and then the corresponding formula.
Thank you so much, Celeste. That's really helpful. So highlighting both logistical and technical challenges in your work. But I was wondering if I could come to you next. And of course, you have a lot of experience with evaluation and also have worked quite extensively with the Department of Labor. So I was wondering if you could speak a bit more about your work within the Department of Labor and how that's been affected. Sorry, you're muted.
There we go. Hi, thank you. Sorry about that. I'm working on 2 sponsored projects that are sponsored by the U.S. Department of Labor. And I'm going to talk about how they've been affected very briefly by the virus problems. The first one is an evaluation of the American Apprenticeship Initiative. This was started several years ago before the current administration. And the idea was to promote apprenticeship. And there are no firm deadlines on that project. So fortunately, what's happened is the Department of Labor has been very understanding, and they've given us extra time when we've needed it to schedule interviews and to get the data we need. The interviews for the part I'm working on, which is trying to compute the return on investment to apprenticeship programs for employers, was always scheduled to use telephone interviews. Which was very disappointing when I found out that Hawaii was one of my sites. But we're still contacting all the sites by phone. We're giving them more time than we had before, and the project's taking a bit longer, but there haven't been any major delays because of the pandemic. The other project has been more of a problem. The new workforce law, or it's not that new anymore, the Workforce Innovation and Opportunity Act, WIOA, required that the Department of Labor establish performance measures for services to employers. And they didn't tell them what they should be, so the Department of Labor is piloting 3 measures. And we're doing an evaluation of those, of how those are being implemented and what the impacts are and what the lessons are for the Department of Labor. Unfortunately, the Department of Labor is due to give an important presentation in, I think in September, to the Office of Management and Budget, and there's no wiggle room there. So we have to get our work done. We were supposed to visit the states that are in our sample. I was supposed to go to 2. We're going to a total of 8 states, and we just could not travel because of the pandemic. So we're conducting all the interviews by Zoom and by WebEx, and it's working fairly well, but it's not as good as actually going to the States. And there we don't have extra time, so because there's a deadline for the Department of Labor. So we've been having to work faster and to work with the states and the Department of Labor to get it done on the same schedule roughly as we had before. So that's been a little more problematic. But we're moving ahead, and we know they have to have it at that time. Thanks.
Thanks so much, Bert. That's really illustrative. Great to hear that you're adapting so well despite the circumstances. So I'd like to hear a bit more about the adaptation from others as well. So I was wondering, Neil, if you could perhaps talk a bit more about how your individual work and your organization work has been adapting.
Sure. Can everyone hear me?
Yes,
okay?
great.
Well, first thing to say, ATQ, we're mainly an advisory firm on social impact bonds and similar things. But we do quite a bit of evaluation work, mainly with Ecoris. So we work closely with James. So really James should be saying some of this, but I'll say it. The main evaluation we're working on at the moment is the Commissioning Better Outcomes Fund, which we've been doing for a while. So as Ellie was explaining earlier, that GoLab is doing the evaluation of the Life Chances Fund projects, which are government funded. We're evaluating the Commissioning Better Outcomes Fund, which is another set of projects funded in England by what is now the National Community Lottery Fund. I mean, James may want to chip in on this, but the main challenges for us are logistical rather than technical, I think. Logistical in some of the ways that's just been explained on other projects. We can't travel, we can't go and see people. So we're trying to keep going a range of projects, particularly what are called in-depth reviews within the evaluation. So they are looking at in-depth, mainly qualitative evaluation of specific projects. And some of those were in mid-flow when COVID hit. And I suppose I'd characterize the technical problems as two levels. One is just the logistics. You can't travel, you can't go and see people, but as previous speaker was saying, you can do some of that by phone. But there's a prior issue, I think, that everyone hasn't got the bandwidth to focus on the evaluation. They're obviously trying to sort out their own projects, as has been discussed in previous sessions of this group, and keep them afloat and work out how they need to adapt the project itself. And secondly, for some of the ones I've been involved in, it's just felt the people you're trying to talk to about an evaluation, it's a second or third order problem for them anyway. So for instance, I should have been talking back in April to a couple of commissioners in South London whose primary responsibility is commissioning in relation to children with special educational needs. And their top priority at the moment is not going to be talking to me about this evaluation. So in some of the projects, we've just stepped back and said, let's leave it for a little while before we even try and contact some of these people. And one or two of those we're now restarting as hopefully the pressure's gone off them a bit and they can give us some bandwidth. It almost feels wrong to talk to them in some ways, if you see what I mean by that at this point. So, James, do you want to add anything on this? So.
Am I allowed, Tanya?
Yes, of course. Please go
You're
ahead.
stealing your chair. I would agree with all of that. I would say, this might answer one of your next questions. I would say one of the hardest things is the level, in deciding how to adapt and what challenges you face, is the level of unknown. What is the scale and duration of the impact of COVID? Because if COVID is a huge shock that lasts 6 months and then we find a vaccine and the world returns to some sort of normal, then the way to adapt is just to pause, leave things alone for a bit, and then in a way continue with what you were doing before. Whereas if COVID completely changes, if COVID is a multi-year issue and completely changes how things operate, then you need to adapt in a completely different way. But at this point in time, we just don't even know that. So I think for many of us, it's either we do quick adaptations, as Neil was saying, of pausing a little bit, but the bigger, do I have to completely redesign my evaluation plan? You have absolutely no idea what the future is going to look like. So even trying to answer that, even knowing whether to adapt the plan, never mind how do I adapt the plan, is a very difficult question to try and answer.
Thank you so much. I think that really resonates with some of the challenges we are experiencing in the GoLab as well, in trying to work with partners who obviously have competing priorities and things on their mind at this point. And with that, I'd also like to open it up to the panel very quickly, just to hear very quickly on any things that have facilitated or impeded this adaptation process. So if anyone would like to jump in on anything that has been helpful or potentially has added to the challenge. Yes, Bert?
Yeah, I wanted to add one other thing that I forgot. In our study on performance measures, the people we're dealing with work on unemployment insurance and the employment service. And I'm sure you have the same problem in the UK, but the caseloads in unemployment insurance have skyrocketed. And some of the staff we're trying to meet with have been diverted to work on helping to respond to the big increase in unemployment insurance claims. And so we're having trouble. So far, it's been okay. We have been able to deal with it, except one of our states we had originally planned to visit was New York, and they were the hardest hit of any state. So they dropped out of the study, and we had to replace them with another state. So that's been especially a big problem for us. Thanks.
Great. Great. Well, if no one else wants to jump in, then we might transition to our next part of the discussion, which is more around impact bonds and outcomes-based commissioning, which of course we at the Government Outcomes Lab spend a lot of time thinking about and researching. So with that, I'd actually like to turn to you, Elle, and I know that we've been speaking a lot about our role in evaluating the Life Chances Fund and how we need to adapt. And also we've been doing a lot of thinking around the role of research and evaluation in outcomes-based contracts. So to you, what are the different evaluation components or aspects within outcomes-based projects that need particular attention compared to other public service structures?
Sure, thanks, Tanya. So I think evaluation and the assessment of outcomes performance clearly has a really crucial role within these outcome-based partnerships, in particular impact bonds. But I think when we come to thinking about adapting our evaluation plans, it can be quite helpful to separate out parts of the evaluation that are directly related to the payment mechanism versus those wider learning and evaluation objectives. So firstly, on the doability of outcome measurements, where the payment is contingent on those evaluation findings. Celeste has already talked about the need to make quite rapid assessments about holding up the integrity of outcome measurement and performance assessment. And it's likely that teams will need to think quite fast about whether the initial outcome measurement tools are still fit for purpose, or whether they need to find kind of the next best alternative that's agreeable for all of the partners, and that can function as a proxy for the meaningful achievement of outcomes. And that might involve quite different approaches, and maybe involving the service user feedback in a more vociferous way. And then secondly, I think there are these wider sets of research questions quite separate to the payment mechanism and that teams might be newly interested in. So in light of the adaptations that have taken place, teams might want to assess the quality of virtual or remote service delivery, or how service users feel about moving onto a virtual format on an ongoing basis. And these new research questions might sit alongside former research questions, or indeed overwrite them and become the dominant questions of the time. And so I think it's really important to get collective agreement on any new priority research areas, and then work up a research plan that can start to answer those questions.
Thank you so much. I'd also like to bring in the rest of the panel at this point, so if others would like to jump in. Yes, James?
I was just going to say, so in terms of the question of, are there particular research and evaluation questions that are harder for outcomes-based contracting versus just general research and evaluation? The other thing that I would say is particularly challenging for evaluations looking at SIBs and outcomes-based contracting is that the problem that GoLab often talk about of the donut problem of you're trying to work out what the impact of the SIB is, but when you're looking at it, it's like a jam donut. You're sort of taking a bite of both the jam and the dough. And am I looking at the intervention, or am I looking at the dough when I'm seeing effects? Well, this is like you've dropped your jam donut into a massive vat of tar or something. You've got the donut, you've got the jam, you've got the dough, and then you've got COVID on top of all of that. So pre this, it was quite hard to disentangle what is the SIB versus what is the intervention. Well, now you've got what is the SIB versus what is the intervention versus what is the COVID effect. And a lot of the time you would try and tease out the SIB effect by asking people to compare their experience of delivering a similar service in previous times. Well, in previous times is just almost a non-question now. So it makes that finding the SIB effect was hard enough as it was. I think it's going to be even harder now because of COVID.
Thank you so much for upholding our donut analogy. But also, so how are you thinking around this in ECARIS, around trying to capture that civ impact at this point? Are you tweaking your research strategy, or are you sort of waiting to see how it goes?
I think it goes back to my first point of it. At this point, it's almost, we're just slightly waiting to try and work out what the scale is. I think generally across, what I was talking about there is what you're trying to do is do a comparison. And the value of historic comparisons is now going down. So what we're thinking about in both our impact bond evaluations, but actually in our other evaluations, is trying to do more real-time evaluations. So I talked before about our adoption study, for example. We were looking at adoption rates now compared to 2 years ago. Well, that's just, I mean, literally no one is adopting now. So you just can't do that. So instead we're trying to look at, well, adoption rates in some places versus adoption rates in other places at this current time. So it's changing what you're comparing it to try and have both areas equally affected by COVID.
Great, thanks so much for elaborating that. Now, Avnish, I see that you have your hand up. Would you like to jump in?
Yeah, thank you. So just want to kind of expand on maybe sharing a bit the kind of research questions that we're seeing, at least in the developing countries where we work in, that government counterparts are really kind of eager to answer. So there's broadly kind of two kind of questions that we see in these projects. The first one is, especially given that we operate in relatively data poor environments, right? Like where governments don't necessarily have really good data on what's happening in terms of outcomes of vulnerable groups, or we have like projects in labor, in the labor space, like, and obviously like many of our government counterparts in trying to design policies to mitigate the effects of COVID, but needing first to even get a sense of what the impact is on different types of populations. So we see that, you know, there's a sort of hunger for information that we've never really seen before, and for evidence on how outcomes are being affected. And these impact bonds in some ways have become a little bit of an interesting kind of high quality data source, because oftentimes we have fairly rigorous outcomes tracking mechanisms. We've been sort of, and the providers that are operating within them also have really good performance management systems that are orders of magnitude more sophisticated than what you'd find within the administrative ranks, if you will, of government. So we're able to, in some ways, provide really good insights. Of course, most of these projects are operating at a small scale, but you can, to some extent, get representative information and be able to dissect that information across subgroups and be able to offer pretty good insights to governments on how outcomes are changing, which can be really valuable for policy making and policy design. So that's one kind of type of research that was not necessarily intentionally planned, but we are, you know, in a very collaborative effort, sharing a lot more information with government partners and in more real time, and analyzing what this is saying about the effects of the COVID in real time, almost through these projects. So the second, you know, research question I think goes towards what Elle was saying. Like, you know, there's a lot of needs right now to innovate service delivery, both for logistical reasons, but also just because I think many governments find themselves with less resources available to you know, attend and serve more people, significantly more overnight. So there's a real need to kind of rethink how you do that. And in many ways, this is also the situation of our providers in current social impact bonds, where there's many more people showing up for service than they can attend. And they're trying to innovate on how they do that. They're also facing these logistical challenges. So we are, you know, doubling down on these process evaluations, on these more operational research efforts to unpack what is happening in service delivery, what are the changes that are useful to communicate to government counterparts that they can also apply and adapt to the policy approaches. So a lot more, you know, in terms of delivery innovation and delivery research going on. And obviously there's only so much you're going to learn through projects that are already underway, because they're fairly well defined and they're going to be constrained to some extent. So we're also, you know, got donors to respond to that in the two outcomes that I mentioned earlier. we're launching like COVID adaptation challenges, which basically will challenge a range of providers to adapt the interventions and to manage to keep the impact high despite changing conditions, despite the conditions being significantly, harder to work to achieve results. So we're hoping to, also create experiments that provide a concrete evidence on how delivery can adjust, what are the delivery approaches that can be more effective, and testing those out in parallel and being able to provide useful insights for policy. So these are the kind of, if you will, two buckets of research questions that have really kind of propped up as a result of the current crisis.
Thank you, that's really helpful. Celeste, I was wondering if I could come to you and perhaps get your perspective on using evaluation in your payment mechanism within the Village Enterprise state. Has that been more challenging? Or has that been okay to manage?
Let me ask you a clarifying question. Do you mean using an external RCT as our evaluation mechanism?
Yes.
Okay. So I guess in general, our RCT it's a cluster randomized RCT. And so operationally for the organization, there have been components of that add to the complexity of implementing programming. In particular, with the clustered randomized model, we end up having staff that need to travel much further distances between villages to go and do mentoring with the previous cohorts while still working with their current cohort. So there sort of the added complexities of the RCT on implementation are sort of there's additive costs or like resources that are needed to implement across that wider geography, and then the sort of pretty much every cycle we have another refresher training with staff to remind them of the protocols that they need to adhere to so that we don't violate any of the RCT conditions. And so of course investing the time and resources and the ongoing capacity building of staff to make sure that we can adhere to the RCT. I guess I would go on a little bit further to say that for this is the second RCT that our organization has implemented now, and for at the size of the RCT, this is still a pilot development impact bond, so it's approximately $5 million in total, but about $4 million for outcomes funding, and about 12,000 households. And so at this size, it is still manageable for us, to implement the program when the evaluation mechanism is relying on a randomized control trial. But we're quite happy with the way that the payment structure allows us sort of both flexibility and incentive to perform, and implications for overall development outcomes. And so we're somewhat keen to scale our portfolio of results-based funding projects as we wrap up this development impact bond. And as we think about scaling, it becomes less clear to us that that an RCT would be a great evaluation option for us because of both the additional costs and resources for implementing according to an RCT, and also because of the villages and the people within villages that end up being left out because of the RCT, which sort of prevents true saturation in areas.
Do you have any thoughts on what alternative evaluation methods you could use then, if not an RCT in the future?
So one of the things that we are hoping to do with our current evaluation data is so the external evaluator is essentially responsible for measuring household income. So that's proxied through consumption and expenditure. And we want to tie that data together with our monitoring data that tells us about the success of the business groups and the success of the business savings groups, so that we can start to look for if we have really high correlations between any of the more proximate indicators. And then ideally we would target use of some more proximate indicators in some form of a scaled up version of the DIB.
Great, thank you so much. Steve Hindle, I see that you've had your hand up for a while. Would you like to jump in?
Thanks, Daniel. So I'm Steve. I work for the Elton John AIDS Foundation. We're running the world's first HIV SIB in South London. I'm here with my colleague, Stark, who's our newly appointed M&E manager. What I'd like to do is to pick up on what Avnish was saying a little bit earlier about the COVID adaptation, and particularly around kind of the practice innovation. And I think one of the difficulties that hasn't quite been touched on is the differences in the kind of adaptations that are systematic and therefore should be sustainable, and the differences that are really inspirational, where a particular individual has just dug deep and decided to do something and involved her or his immediate cohort. So that it's been very impactful, but maybe not sustainable. And I think that's something to think about as we kind of consider, is the adaptation something that can be sustained because it's within a system and has its own payment mechanism, or is it something that's just a human reaction to a very difficult situation and somebody's gone completely beyond the bounds of what they would normally do?
Great, thank you so much for flagging that, Steve. Just to move us on to the final part from me, which is the third part of the discussion, around balancing our existing research with the new research opportunities that many of you have flagged and are already working on to some extent. This is a bit about thinking how researchers and research funders are thinking about the relative benefits and costs of continuing existing research versus changing them midstream. And so I was wondering if I could come to you, Bert, and hear your perspective on how you've navigated and negotiated changes with your Department of Labour colleagues on the projects that you mentioned before.
There we go. Yes, we had delays even before the pandemic struck. We had a year-long delay in one of the projects in trying to get approval for our survey, and that also caused problems. And so we're trying to accomplish things more quickly and still focus on the main things. One of the things that may occur is that we may spend less time writing a long final report and instead focus on writing some briefs or some shorter reports that address specific subjects. What we haven't done is change the subject of what we're looking at, because that's pretty much fixed. These are contracts, they're not grants, and they're on very specific things like evaluating this apprenticeship initiative and giving the Department of Labor advice on what they should do about measures, performance measures for employer services. So they want us to focus on those. Actually, in the employer services project, one of the tasks we have is to recommend a follow-up evaluation if we think one is necessary, and we'll suggest some additional things that have come up during this evaluation that they may want to look at in trying to implement good performance measures. But these haven't been the kind of things where we really changed. We have noticed some other good topics for doing research. I mean, the big problem right now is our unemployment insurance offices are just flooded with people. The number of new people filing is way up. And I noticed in reading the paper today that one of our states had $300 million in fraudulent claims. So there are clearly some needs that have come because not only from the pandemic, but the high unemployment that's resulted. And so there are some additional projects that need to be done. They're just not part of this specific project that I'm working on.
Great, thanks so much, Bet. Elle, I was wondering if I could come to you. I know that we've been involved in similar conversations with central government here in the UK, particularly with DCMS, thinking around existing research versus new COVID-related research. So I was wondering if you could speak a bit more about that.
Yeah, sure. We're fortunate to have a really good working relationship with the funders of most of our research. And so we're trying to accommodate these new research priorities within broadly the same funding envelope for our research by doing a little bit of scaling back on some of the intensity around the long-standing research priorities without abandoning those pre-agreed research questions, and then pivoting to do some additional research around these new research questions. So in the Life Chances Fund, for example, we were expecting to work with 3 detailed longitudinal study sites, and in practice we're probably considering scaling back to just look at 2, and then spread the rest of our research capacity to look at some of the responses and adaptations that have been made to COVID around the social impact bonds in the Life Chances Fund programme.
Thanks so much, Elle. I was wondering if I could open it up to the panel, and if we could talk a bit more about this sort of striking the balance between having credible research, but also providing quick intelligence. Because often we find that, of course, a lot of our work takes a lot of time, many months or years sometimes to put together. But of course, the need right now is for policymakers to have very prompt and quick intelligence, which is, you know, a good level, but perhaps not the sort of level we aspire to usually. So how do we navigate that, and how do we try and retain the best of both of those aspects?
Could I mention one other thing? One of the things that's come up again on the project that has a very tight deadline, but we're also having trouble with the schedule, is they asked us to prepare essentially a PowerPoint presentation with all our key findings and submit that way before the final report so that they have the main message. And I think that's a good strategy on their part, so that we can, and actually it'll be helpful to us. What I pointed out to my colleagues is if we do a good job in preparing the oral presentation, it'll be a good outline for our final report. And yet you don't have to take all the time to write all the nuances. So I think that's a good strategy that they suggested, so that they can get the information when they need it, and at the same time allow us to convey what the main findings are.
Thank you, Bert. That's really helpful. Anyone else want to jump in?
I was going to jump in.
Yes, Neil.
On your specific question, Tanya, about rapid response, having been involved in evaluation and implementation of programs as well, including one quite big one that some of the people on this call are familiar with the Home Office at the moment. So there's a Home Office program called Trusted Relationships, which is actually being evaluated by Business Behaviour Insights team and GoLab together. And we have a different role in that program. We're an implementation partner, and I don't want to bore on about that program in any depth, but it like many others, it's had to adapt. It's not a SIB program, it's a grant program, but the issues are very common in terms of both how the evaluators are having to adapt what they're doing to try and get reasonable results, but also how the projects themselves are having to adapt. And I think if people are looking for rapid views, they might be able to get that from an evaluation, but they're more likely to be able to get that from the teams themselves. I noticed that Tom Jefford, who I know quite well, has been commenting on the side that he's had to switch some of his interventions over to remote working, which we've seen on the programs we're working on. And people are saying, well, that's okay. But he's getting questions like, how effective is that compared to what it was before, which I think is a slightly unfair question. My impression is most central government and local government programs are being cut quite a lot of slack, frankly, to say, do the best you can, and then we'll see. But certainly on the programs we've seen, they're getting to the point of saying, at what point do we have to say that there needs to be some face-to-face contact? Because what's being done is heavily reliant on there being trust between the people providing the support and the people receiving it. And some can adapt well to remote working and some can't. So it actually comes back to James's insight earlier, in fact, that it just depends how long this goes on. Because at the moment we're saying it'll be fine for probably another 2 or 3 months. But if things go on much longer than that, then I think all these questions will start to surface much more. I also think there will be, there's a potential for some evaluation programs that just say, oh, look, let's just call a halt to the evaluation as is and do something else with the money because, and the resource, because it doesn't make sense to continue with it. But that's my usual sort of slightly forthright view that others may not agree with.
Thank you, Neil. More on trusted relationships. I was wondering, Claire, if you could jump in, and then I'll come to you, Elle. I see that you have your hand raised.
Yeah, sure. I mean, as Neil mentioned, it is our team that's doing some of the evaluation work. And Neil, I do think that's exactly right, particularly with a program that sort of the theory of change here is predicated on the building of a very personal and personalized relationship between a sort of key worker or a mentor of sorts and a young person. Doing detailed qualitative work on the phone prevents you from really understanding the nature of that kind of relationship. And so the evaluation decisions that we've been trying to weigh quite carefully are around, yes, we can move forward with telephone interviews and whatnot with staff and potentially with young persons, but that is going to be caveated potentially in a way that our sort of in-person work would not necessarily have had to have been. And indeed, I think there's a sort of longer term question of how those interviews happening at sort of time 2 are understood when indeed the evaluation is envisioned to spread across a number of years. So, you know, you do think through these things, particularly when you're doing sort of longitudinal work. These are unique contexts taken at a particular time, but they will eventually need to link to other evaluation activities on the same program. So.
Thanks, Claire. Elle, you had your hand raised?
I did. I was going to return. Well, I felt like I couldn't leave it hanging. You put out quite a tricky question in terms of the balance between producing credible research and providing this more rapid intelligence, and that being particularly pointed an issue at this point in time. And I think this is a really tough one, and it's a tightrope that the GoLab team is trying to walk all the time. I think, you know, this Ergo group is a great example of really quick intelligence sharing and a great sounding board for practitioners, particularly where people need to make really quick decisions. And I know that as a research team, we listen in. And so we use the insights that get shared in this Ergo peer learning group to try and shape and inform the kinds of research that we ought to be undertaking. But I think as a team, we also try to pursue that sort of slower burn, independent academic inquiry. We sort of try to be worthy of our University of Oxford badge on some of this, which means that sometimes we are working on a longer time horizon. We are trying to triangulate data. We are trying to go through academic peer review. And I guess we just try to signal where our insights are coming from and the process that we've been through in getting there. And also, I think relating to some of the challenges, just trying to be humble about how far you can go in pushing the robustness and reliability of the findings on short time horizons.
Thank you, Elle. I also know that we have a lively discussion going on the chat, which is really great. I am running out of time for my part of the session, so I'll just point a very last question, which is more around quick reflections from the panel on if you see any long-term challenges or impacts for social policy and public policy research, whether that's on data collection, data monitoring, or simply evaluating impact. So any reflections, please shout.
I think the really obvious one is going to be budget. What happened, what happened last time we were in an economic recession, and what happened to the amount of funding on research? It dropped, and I think we've got UK alone has £65 billion worth of debt now as a result of this. I worry that research is not going to be the priority after this. So I think funding is going to be a concern.
Celeste, I see you have your hand raised.
Thank you. So one of the things that we're thinking about as we think about our end-line data collection for our DIB is we're working with an international evaluation firm, and it's quite likely that by October they would be able to collect data to manage data collection in Kenya. But Uganda has been a little bit stickier when it comes to lifting restrictions, and it's not clear to us that that is an international firm, they would yet be in a position in Uganda to collect data. And so we've started sort of preliminary discussions around thinking about partnering up with a local evaluation firm to see that the data collection can actually happen. But of course, the real concerns with that are that there's less control on the part of the international evaluation firm over the quality of the data that comes in. So as I think about the situation that we're in right now and think about sort of like takeaways for researchers moving forward, one of the things that I think about is how this sort of exposes a need to foster those relationships on an ongoing basis with local firms in countries that we're working in, so that when situations like this do arise, there's lower concern about the quality of the data if it does have to be the local firm that collects.
Thank you, Celeste. I see Bert and then Neil.
Yes, thank you. One thing that happened the last time we had a big crisis, which was the Great Recession a few years ago, was that I submitted a proposal with the National Association of State Workforce Agencies to document the impacts of the Recovery Act. This was not a fancy impact evaluation, but more of an implementation study of how well all the Department of Labor efforts worked in trying to deal with the Great Recession. So we went to 20 states and 20 local areas, and we wrote up the success of about, I think there were like 5 different programs that were implemented, and there was a book published, and I can send anybody who wants an electronic version of the book. And we have some lessons that I think will be useful in dealing with the high unemployment that's come this time. So the lesson here is I think it's good to document all the efforts that are going on now, in addition to the individual research projects and how successful we think they are.
Thanks, Bo. It'd be great to have that book, actually. We'd be happy to share that with the participants if you like. Neil, and then I see Avnish.
Yeah, it's just a great. Well, first, I agree with James. I think all of us who at the moment are being reasonably fortunate in being able to adapt to working at home quite easily might find things a bit tougher in a year or two when people decide where they've got to find some savings from. Having said that, some of these projects are about creating savings, so that might work. The thought I had though is where there's been a couple of people today picked up on something that we've seen in some of the work we've been doing, which is programs that everybody assumes are face-to-face, adapting fairly well with some of the caveats I was mentioning earlier to being done remotely. And I have been frustrated in the past to see just how slow some parts of the UK have been, particularly in the public sector, I have to say, to adapt to those sorts of things. All of a sudden, things that people were saying were impossible, like GPs having remote appointments and working on Skype or Zoom with patients, are, hey presto, far more possible than they ever were before. And it would be quite interesting, I think, for somebody to try and research just how effective different types of interaction and intervention are compared to what they were before, and how we could do more of that. There's been a lot of comment that we will automatically be doing more of that in the future because we'll all adapt to working this way. But it would be really useful to know. One of the things I've seen, and again, Tom Jeff had commented on earlier, is you don't have as much, so you don't have as deep an interaction necessarily, but you can have more interaction. You can have shorter and more frequent interaction. Or you can get more people involved because they're prepared to join in on one of the teams I've been working with. They've been having Netflix parties. They were supposed to run group sessions with vulnerable young people, but instead they've been running Netflix parties. That means they're not getting the sort of deep analysis and understanding of their issues than they might have been getting, but they've been getting a lot more engagement because people would rather join the Netflix party. It'd be quite interesting to see some comparison of that, but I wouldn't want to necessarily design the methodology for it because it sounds quite tough to do.
Thank you, Neil. Avnish, on to you, and then I'll pass it back to Claire.
Thank you. I just have like two hopes for how this can actually be an opportunity as well for the future of research and data collection. So one at the institutional level, and again, talking about the developing country context, oftentimes we end up spending large amounts of money to create like reliable databases and have to do like, first-hand data collection because we just can't rely on administrative data and the quality is just not there yet. In some of the countries where we work, we are seeing that the current crisis has generated just a whole different level of interest from government counterparts to invest in data integration in data systems, which is extremely beneficial for this line of work. Whether that's going to sustain or not, remains to be seen. But in a place like Colombia, for example, right now, the government is for the first time like bringing data from different ministries in the same place, really investing in the quality of that because that's needed for quality decision making. And I think that prediction is that they're going to continue needing it for the next 2 years and more to make money go a longer way in this crisis. So there's generally a great awareness and interest in data-driven decision-making and investing in data infrastructure, which I think can only be good for outcomes-based financing. And we hope that we can, in the future, leverage those data sources more as opposed to kind of trying to build these, parallel islands of data, which each of these projects end up being, which ultimately is not sustainable, very expensive, and so on. Then we're also seeing, in terms at the level of the firms and evaluation organizations and firms that we work with, they are also innovating on how they're collecting data and using technology much more, which could also lead to kind of, reduction in cost and interesting disruptions in how research is conducted, which also I think would address longstanding concerns around cost of data collection and evaluation processes. So hopeful that there's some silver lining in the challenges that we're seeing right now.
Thank you, Avnish, and thanks everyone for those interesting examples and innovations. As you said, it's great to see at least some good coming out of this situation. I'll pass it back to Claire now. Sorry for running over, for some summary comments and also to facilitate the last topic.
Yeah, absolutely. I think to date, the conversation has been really helpful in terms of addressing some of the 4 topics that we'd outlined at the beginning. Really understanding that there seemed to be this sort of bucket of logistical challenges and then maybe a bucket of technical challenges as projects are thinking through making amendments to the research and evaluation tied to them. I think James made a really great and helpful point around it's difficult to make these decisions around changing evaluation and research strategies because of the level of unknown, wherein, you sort of have a how severe and how long interdependent question there. One where if it's short and discrete, perhaps it's a decision to pause what you're doing, versus if it's ongoing, there is probably a compelling reason to recalibrate what exactly falls into your research strategy as tied to a particular program. We also had a really helpful conversation perhaps around the unique evaluation challenge present in outcomes contracts, wherein an evaluation isn't just explicitly for learning purposes, but indeed is fundamental to how this deal is paid for. And so what kind of flexibilities might you have or not if your evaluation is also tied to the way that contract is compensated. And then I think, the place that you just left us, Avnish, is a really helpful one, which is around kind of what are the new horizons and learning opportunities available to them. Bert, you mentioned the work that you had done on the back of the Great Recession in looking at the Recovery Act and indeed how that money goes out the door. That's conceivably a similar sort of opportunity available and in this sense, you know, across context globally, as everyone begins to reposition themselves and deal with an ongoing stimulus of sorts where that is applicable. What I'd like to do, though, is kind of start off this conversation. We'll do it for the next maybe 5 to 10 minutes or so before we open it up to the audience around what these new opportunities look like. And I'd like to start with you, Avnish. You mentioned some sort of rapid experimentation earlier, and I want to know more about that. So, and in particular, I'm curious around how you are perhaps prioritizing different experiments and how you're structuring those experiments for rapid delivery.
Yeah, great. Happy to share. So we have 2 examples of that. One is with the Poverty Alleviation Outcomes Fund that we're in the process of launching in Kenya and Rwanda. And we had already a portfolio of around 15 organizations involved in delivery, and they're mostly sort of like, you know, cutting edge organizations that are deploying different types of interventions that are meant to work with ultra poor families and get them, you know, to build a source of livelihood. So that's a little bit the context. So what we've realized is that, you know, especially for our experience with Village Enterprise, which is in that same line of work, and we're understanding for that process the challenges they're facing, also in conversations with governments, understanding that delivery of social protection at the front line is needing to adapt, and they have a huge pressure, budgetary pressure to do more with less resources. So there's a real need to innovate on delivery and to innovate on how this is delivered and on the logistical aspect of it. So what we are setting up, we've managed to raise about $1 million from a foundation to simply give like a rapid runway of innovation and testing for new delivery approaches and methodologies that could be interesting to test out and to see if there is some indication that we can, you know, significantly improve delivery efficiency in this new environment. So this is what this fund is about, and we're probably going to, we're just launching the RFP next week, and we already have the organizations identified, and we'll be giving these organizations on 6 months. And this is not going to be, you know, like RCT or anything like that. It's really just an operational research exercise on delivery approaches and how this is adapting and what are the best ideas out there, and bringing the government along in this learning journey that can hopefully rapidly, you know, take up some of these ideas in their own policy-making decisions. So that's one example. The other one is here in Colombia, where we've been working on launching this outcomes fund on workforce development, so job placement and job retention for particularly vulnerable populations who are out of work for a significant period of time. And similar challenge, right? Like the Colombia just, you know, reported last week that 5.5 million jobs have been destroyed in the last month only, which is a massive number, with particular impact on women and especially young women. So there's a real interest to learning how, you know, and many of these services we've been working in this space for a while, it involves a lot of like, you know, face-to-face. So many of the traditional service delivery approaches just are not as appropriate anymore, can't function as well. And when you think of the scale of the problem, right, like this kind of face-to-face delivery approaches are unlikely going to be the right way forward for the government, because just the scale of the problem has massively increased. And these operational models are not easily scalable, nor are they sort of scalable from a financial nor operational perspective. So we're really having to completely reinvent, you know, the delivery process, and probably it has to involve some technology aspect that can scale a lot. Has to involve some new partnerships with perhaps like mobile phone providers being very central to this process to reach to these vulnerable populations. So even the players who are part of this innovation process are different, right? So what we're doing is we've kind of structured an innovation approach where we've unlocked a lot of the previous constraints on delivery models. So leaving it completely open, We are trying to also go towards new types of actors that we were previously not engaging with, that could have some capabilities that we feel are really essential for any innovation to respond to the scale of the problem right now, and creating a little bit of a process that can maintain the flexibility that was a part of the original design, but reduce the risk levels and also reduce the level of the prescriptions of the intervention process that we had before. So just opening up the black box, if you will, to be even more innovative. And going towards new partners, and not making this about risk transfer, but more making this about like a flexible innovation process. So that's what we're launching again in the next few weeks to try to provide new insights and new models of delivery to the government.
Yeah, I think that's really interesting to hear the notion that the risk transfer is perhaps a less salient component to some of these models, where in fact it feels like it's almost incalculable. So I think kind of related to that idea, one of the questions that has come up quite a lot, and indeed is related to this notion of future opportunities. James, I'm coming to you, so get ready to answer this question. But that's really around, we've talked perhaps about the unique elements involved in an outcomes-based contract. And I think there's two camps, which is outcomes-based contracts are fundamentally different and indeed are way better at adapting to what's happening, versus other camps who say these are the same thing as any other public service contract. Everyone is flexing. How do we even know if this is flexed more? But I kind of want to hear from James and then others in terms of what the role is of perhaps impact bonds or social enterprise, social investment in the response and recovery phase to COVID-19. And is it actually unique and separate from any other tools that we might be using to come out of this?
Oh, I really wish you hadn't come to me for that. Actually, interestingly, I think I'm going to steal Avnish. Maybe could just step in. I'm going to steal Avnish's answer, because there was a very similar question asked on a previous one of these, and Avnish gave an excellent answer. So I'm just going to paraphrase that, because I don't think I could do better. So thank you, Avnish. Which was
the royalties.
Which was that can impact bonds help in the immediate term to some of the issues we're facing? Probably not, for the reasons being that generally their scale is, the scale of the issue is incredibly large, and the speed of the response has to be very fast. What do we currently know about impact bonds? They take a very long time to launch, and typically they're not very large. So can you launch suddenly a load of impact bonds that are going to help in the immediate aftermath of this? Probably not. But also, I'm also going to steal Louise's answer, because she gave a very good one before, which is, so maybe the pure impact bond model isn't necessarily the thing that's going to help with some of these large scale fast changes, but that's not to say that some of the principles that sit with an impact bond around greater accountability, around much tighter focus on outcomes, maybe attaching payments to outcomes, that's not to say that some of those things can't also be applied. So maybe, and I think we're constantly trying to look at changing the impact bond model anyway. So I think it's some of the principles of outcomes-based contracting could help, but I'm not necessarily convinced the SIB itself is the answer.
Anyone else on the panel want to comment on that? Celeste?
I guess I would express agreement with the notion that principles behind the DIB and the SIB could help with development outcomes. In particular, as we think about sort of like the participants that participate in these projects, there's arguably a need on the part of the implementer for to adapt, both in terms of being able to continue to deliver the services that they already committed to delivering, but arguably also a need to adopt to add additional services that come up in response to the COVID crisis. And like a principle behind a DIB and a SIB should be that the implementing organization does have the sort of like the flexibility to adjust those activities, and also, the incentive to adjust those activities. But then importantly, there's also the funding aspect. And so I would also point to another principle of DIBS and SIBS, which is the theoretical priority of the investor to protect their investments. And so theoretically to be willing to provide additional support to the implementing organization to be able to either adjust implementation or add on new implementation is needed. And I would say that our experience is, I mean, we're still at the beginning stages of really trying to decide how fully we will, what our full response to this current crisis is. But so far, what in our engagement with our investors, we're seeing that principle hold true as well.
Thanks for that, Celeste. Yeah. Elle, I'll come to you and then we'll pass it back over to Tanya to take some questions from the audience.
Thank you. I found those comments really helpful. I suppose the other thing that I would just throw out is that we keep talking about SIBS and DIBS as if they are one or two particular things. And actually, I think we see enormous variation across the projects that call themselves with these names. And the extent to which payment is made contingent from outcomes varies an enormous amount across these projects. And hence the degree to which independent investors are actually holding risk it also varies considerably. So I think this is a really interesting opportunity to see how a range of partnerships and a range of collaborative structures actually thrive or succumb to pressures of this really challenging operating environment. And so it's going to be really interesting to kind of keep our eyes peeled as to how these different structures respond in potentially quite different ways, I think.
Yeah, I think that's really helpful because, you know, impact bonds are sort of, you know, collaborations or partnerships that have a discrete kind of financial imperative built into them. But indeed, we see those structures exist without necessarily that discrete financial imperative. And conceivably, their ability to recalibrate and adapt to changing contexts will also vary. And shouldn't we be tracking that? So anyway, I'll stop there. I'll pass it back over to you, Tanya, for questions from folks on the call.
Great, thanks Claire, and thanks everyone for a really helpful discussion so far. So moving on to questions and comments from our very patient audience. We have something from Cornwall, but before we go into that, if anyone else has more questions, please either pop them into the chat or simply raise your hand and I will come to you. So Cornwall is a partner at an advisory firm in Pakistan, and she has written to Neil's point on logistical challenges around some of this. And so our question is, how do we look at it in terms of data integrity, particularly when it comes to data collection, whether for evaluations or otherwise? So whether Neil, you want to go for it, or anyone else in the panel?
I feel like I would have been better taking the social investment question, and James would probably be better taking this question.
Comment on both, so please.
Well, I think the issues are the same. The data, you've got to make compromise, just as we were talking earlier about compromises in the intervention itself, that you accept some compromise there. I think there needs to be compromise around data. If you can't get the data at all, then clearly you've got issues. But to some extent, you've got to say, let's see what we can do with the data and what's available, unless it completely confounds your whole project, which is entirely possible. But if it does that, evaluation is the least of your worries, it strikes me. But that's just... James, have you got a better view or somebody?
No. I do think it speaks to a point that Elle was saying about something else, but I think it's also about if you're going to do that, you also have to be humble, and you also have to change some of the rhetoric around these things. So the idea that they're impact bonds and you're only paying when you know what works and what is achieved. What I think we're actually seeing is that, is this perfect measurement? Is there perfect, are we capturing perfect attribution? Are we factoring in things like dead weight? Not really. So yes, okay, let's be more relaxed about the quality of the data and the rigor, but then also subsequently, let's be more humble around what these things actually are and what you're paying for.
Thanks so much. Does anyone else want to weigh in? No. Okay, well, in that case, we have a couple of really helpful comments from our participants. So I'll go to Tom Jefford first, who's spoken a bit about working with young people on the edge of care and delivering services remotely. So Tom, if you want to share your comments with the rest of the group and potentially ask any questions you might have.
Sure, thank you. So, I mean, as a provider, we've become fairly used to the unreasonable demands of commissioners and investors, which in the current period have become a little bit more unreasonable and demanding. So that's been a bit of a challenge, but it has driven innovation. So we moved to online working very quickly. We've got questionnaires that we expect families to complete, put into forms that we could send to them, and actually we've seen really increased, and my cat's going to join me, really increased numbers of completions. We've seen some innovations where we've had families engaged that wouldn't have engaged before because they can all sit in a different room and be on Zoom. We had a parent who's a long distance lorry driver sitting in a lay-by, participating in a family session he'd never participated in before. So there are opportunities for things to be different and to work better. The question really is, how can we prove that this is as effective if we are doing something that's less than gold standard? We're in no particular rush to go back to doing face-to-face in people's front rooms because that seems to be one of the most dangerous places you can be so far as COVID is concerned at the moment. So we're trying all sorts of other options to be flexible, but also to try and deliver something which we think is going to be as we intended it. And that may be a variation in terms of length, duration, intensity. There's quite a nice thing on the BBC see about why if you are on Zoom too much, can't pick up on the same cues. So we don't really want to be sitting with the face mask on in someone's front room because actually you can't respond to emotional cues. So remaining online for longer may be where we end up.
Thanks so much, Tom. We also have a very helpful comment from Edward Hickman on trusted relationships and service user qualitative research. So if you want to share with the rest of the group, Edward.
Unmute, there we go, just unmute. Thank you. It was really just picking up on a couple of things I think both Celeste and Bert have touched on, which is that all these services generally with an outcomes-based model around are effectively services around individuals. And therefore, I think there is scope in the evaluation sort of adaptations to really work on what the individuals are saying. So you can still be in touch with them one minute, as long as the service, I think Celeste said, the service model can adapt. The whole notion of, particularly the SIB-funded models, is flexibility. So, or potential flexibility, notwithstanding the fact that quite a lot of them are built around fidelity programs. But to my mind, that leaves opens an opportunity for the evaluation to basically feed into the way that the services then adapt. And it also then feeds into this idea of co-production, which is a kind of sort of mantra that floats across government, as we know, and this idea of service user involvement in the services that they receive and get supported by. So I just wanted to ask any of the panel whether they thought that's the sort of adaptation that a lot of it's qualitative, obviously, and therefore quite subjective. But as I said, in the Trusted Relationships program, Claire and colleagues are managing to carry on with some of those end user interviews. And it's really the value of that, I suppose, is what I wanted to test.
I see, James, you have your hand raised. Would you like to refer to that question?
Yeah, I just wanted to say, you're definitely right that in terms of qualitative research, it hasn't completely stopped because you are able to do quite a lot online. We had a whole research study in Latin America, and we had to cancel all of our visits to Latin America. We still managed to do it online. But I think I would caution against saying that that is the future. Online research and qualitative interviews creates a whole host of issues. And we've been grappling with some of these in some of our service user research, from safeguarding. Normally when we speak to service users, it's brokered through the service. there are whole kinds of safeguarding and GDPR things you have to think through when you're, say, Skyping teenagers in their bedrooms. Like, is that appropriate? You have to get loads of personal data from that person to do that. You have all sorts of sampling issues, because who you can speak to are really those that have the best internet connections. And also the quality of the interaction, as Claire was saying earlier, is much less. So I think definitely it's a short-term solution. I think we've been kicking around this internally. Should we do more online research now that we suddenly can? And I think the quality of the research is actually much less when you go online.
Thank you, James. Coming on to Ian Marr, who was actually also following up on your comments, James, and speaking a bit about the post-COVID response phase demand and what role social investment has to play in that. So Ian, would you like to share that and ask any potential questions from the group?
Yeah, it was just follow up some of what James was saying. There will undoubtedly be a significant surge in demand in all kinds of services post-crisis, mental health, employment, homelessness. There'll be a whole host of different services that you'll see a surge in demand, and that will happen at the time when there'll be immense pressure, I suspect, on public spending, because they've been spending relatively freely recently. James referred to 65 billion debt in the UK. That is not a sustainable policy. So you're going to have a surge in demand. At the same time, you're going to have immense pressure on public spending, and probably the current emergency funds being exhausted. So does social impact investment, in a generic sense, whether you call them something else, offer an opportunity to address that in terms of creating services relatively quickly on the ground, because they access third-party capital? They don't need immediate public expenditure. If payments made later, is that a strength potentially?
Thank you, Ian. Any responses from our panel?
I think it could play a role, but at the moment, I don't see social investment as just being big enough, bluntly, as a way of coping with the sort of issue. By the way, it's, as I understand it, we're spending 60 billion a month. I mean, it's not 60 billion across. At current rates, we're going to have a deficit that makes the one we had 10 years ago look like a Vicarage Tea Party. So it's going to be quite a challenge. I think what I think we might get is some learning from some of the projects that have already been done, because what I sense is a bigger interest than I've ever heard before in things like children's mental health, in preventing homelessness, because temporarily at least we've taken the crisis homeless cases off the streets. And if we could find a way to do it, there's just some real opportunities to try and eradicate some of those problems longer term. Social investment can play a role, but I just don't see it having the scale to really attack the problem. I may be wrong about that. There may be, certainly I don't think, I agree what James was alluding to earlier, SIBs themselves are too small and rigid in general to make a big difference. Social investment applied in more innovative and interesting ways could make a difference, but even so, it's what, 4 or 5 billion across the UK? I'm not sure it's going to make enough difference quick enough. But on that unhappy note, sorry.
Thank you, Neil. Well, if there are any other responses to this, please jump in. But also I wanted to come to our panel and ask if there's any final reflections before I pass back to Claire for concluding thoughts. Anything you'd like to go back to, expand upon, or talk a bit more about? Or just leave us with some more questions and food for thought.
I'll try and link, I think, a little bit to what Ian was saying there, but also in terms of kind of where does this leave us, I think, as a research community. I think in many ways what are seen as the big and important questions actually loom even larger in light of the COVID emergency. It's this space between the announceable funding commitment and the frontline service delivery. What are the funding arrangements and the contracting structures that best support sort of resilient and responsive, good quality service delivery? How should we be holding complex service delivery systems accountable for performance, do these outcome-based approaches offer an improvement compared to more conventional service funding arrangements? I think these questions are still really live and really relevant, and arguably more so if we're going to be spending that much cash in the near term. So I think that a lot of the questions still stand, and we really need to work together to drive up the amount of research work that can speak to those.
Thank you, Elle. Anyone else? Okay, I think that might be all. Thank you so much for your questions and comments, and obviously to our panel for their wonderful remarks. Pass it back to Claire to conclude the session.
Thanks again, everybody, for a really stimulating conversation. I think obviously we've got some maybe lessons we can pull through from everyone's mutual experience of the Great Recession in thinking about what structures we put in place in terms of spend ongoing, and indeed what the role of social investment in that might be. I think a lot of these conversations and topics we'll pull through probably in next week's open discussion forum. So if you've got more in your mind and you just need to sort of think on that before you articulate it to others, next week is a great space to do that, and we very much welcome you in that conversation. And with that, I hope everyone enjoys the rest of their day, and we'll see you soon. Thanks so much.
Thanks, everyone. Bye.
Thank you.
Thank you.